Can we explore monitoring of exposure to hazardous drugs in more detail? How is it done, and how do you know if people are exposed to unacceptable levels?
That's a complicated question, but I will try to answer it because this part is often not done in hospitals. And the reason I think why it's not done is probably that it's rather complicated to do and to explain the results and how to interpret the results and follow up. Uh, there are actually two main issues that are relevant when people are handling hazardous drugs, and we focus on pharmacy, we focus a little bit on nursing, so within the hospital, the main group. There we have to deal with two exposure routes that are relevant. The first one is that you inhale the drugs, you get it in your body by inhalation, nose and mouth. That's one point. And the second is that you get it on your skin. For instance, you have it on your hands, you get in contact with the drug by contaminated surfaces. These are the two main issues. Well, the air sampling is only relevant when you deal with powders or things like that, which are not so frequently used in hospitals. It's mainly when for special preparations or products or whatever is needed, then you need some powders to handle. But mainly it's hospitals that deal, pharmacy that deal with vials, which are encapsulated drugs, and from that you do the preparation, do the compounding to set up an administration product that can be a syringe, that can be an infusion bag, that can be an infusion pump like this. And in that process, the main risk, the most important risk, is getting in contact with contaminated surfaces. That can be within in a cabinet, that can be on a bench, that can be on products, whatever. So everything you can touch can be contaminated and you can get in contact with it. So the exposure risk is there. So that's the reason why you have always to wear gloves, protective gloves, to avoid any contact with contamination on surfaces, to get it on your hands, because when it's on your hands, it can get into your body and then you are exposed. So for that check, we and a lot of others do the surface wipe sampling, because the surface wipe sampling is showing that you have drugs on surfaces in the environment, which can finally end up in exposure of the workers. So these wipe testing they're quite simple to do. It's just you swap a surface with a liquid and then you have a sample. And you send that sample, you send to a laboratory, and then they analyze how much drug is in it, and you can correct it on the surface area you have sampled. So you get a contamination on a square centimeter or square inch or whatever you want. That gives you some information, so you can find high levels or low levels or moderate levels. And then you get the problem how to interpret this.
So how do you tackle the issue of interpretation?
We ourselves do it very practically. We have a kind of a traffic light model, which we have introduced years ago. And it said below a certain level, we call it green, and above a certain level, we call it red, and in between it's yellow and orange. And that means that gives you an impression how to handle the contamination issue. Unfortunately, there is no threshold limit saying you should be below this, or you cannot be, it's not allowed to be above a certain level. But it gives you a first impression about the contamination and your working conditions. If it's all low or not detectable, you have a good working procedure, all is fine. When it's high, then there are probably spills and leakage, and you can, according to the results, you can make changes in your process or in the devices you are using.
That's very useful. Now, one of the things that you mentioned in the workshop was having safe systems of working. What kinds of things does this cover?
Just give some examples for pharmacy, for compounding. I think most relevant is, with all these issues on hazardous drugs, is that you prevent exposure. Prevent that drugs get in the environment and prevent that people get exposed. So prevention is the first step. And because if you don't prevent and you cause the problem, you have the problem that should be solved. So then you have a lot of extra work to do to get rid of the problem. So if you can prevent that there is a problem, you are on the right way. When I look in compounding and preparation in hospital pharmacies, of course, they have the clean room facility, which is well organized. They have a safety cabinet. They have an isolator. It's all the technical things are in place. But finally, it's the work of the technicians, the pharmacy technicians, that it's not like a robot. They work manually and people make mistakes. And we see within these cabinets and within these isolators that there are spills, there are leakage. You don't see it, but they are there, because when we do the surface wipe testing in an isolator or in a cabinet, we see spills of drugs there. The point is, as long as it stays inside and not getting out on a product like an infusion bag or a syringe or whatever, then it's fine. But there is never a guarantee that it's clean when it's leaving the pharmacy and going to nursing. So to avoid all these problems or potential problems, the way to solve this is using closed system transfer devices. It's a kind of a technique where you transfer the drug from a vial, which is the primary packaging, to the end product that you're preparing. If you have that process closed, and there is no spill or leakage, you will not have a contaminated product and you will not spread the contamination. So I would say 90–95% of the problem can be solved there. Then there is the remaining issue, and most pharmacists, they talk about it. They say, well, we get the drugs in these vials, and these vials are mostly not clean on the outside. So when we have these vials coming in and they are contaminated, we start already with the contamination and spread it. So the second recommendation, and I think relevant, is try to buy clean vials. So try to get vials that are clean from the outside and guaranteed by the pharmaceutical industry. So if you cover the clean vial issue and you cover the potential leakage by using CSTDs, almost the whole issue of contamination, aside from accidents, because they can always happen, aside from accidents, the normal process can be 100% controlled.
And could I ask you, Birgit, what kinds of safe systems do you have in real life in your hospital?
So we have engineering controls. You work at this moment in BSc. Our people have also PPEs to wear, like a gown, gloves, other PPE. And then we also work with CSTDs to prepare them, so to avoid needles for like needle stick injuries. And besides of that, we have a lot of procedures for how to work with these. And we also do some education and training on people that work with us.
Oh, could you just remind us, what is a BSc and what is a CSTD?
BSc is a biohazard safety cabinet, so it avoids that your workers are coming in contact with the products they work with. It's a safe environment to work in. And the CSTDs, that are closed system transfer devices. So it means that you have a device that you put on the vial with your drug, and also one on the syringe, which you will use to take your liquid out of your vial. And it's all working without needles, so it's really safe. It also avoids aerosols to be spread in the environment. So it makes it like a closed system to work with these products.